being followed. We are joined by an extremely interesting panel of experts who will help us understand this process better. We have Mayur Shetty, who's the CEO and product architect of Blackfrog Technologies Private Limited. Now, this is a government-funded startup that's looking at how medical-grade refrigeration systems can address the last-mile problem that is associated with the delivery of vaccines. So that's a very crucial question that we'll ask you. What do you foresee, Mayur Shetty, as some of the big challenges in order for this vaccine to reach, the far-flung areas in the country?
Yeah, that's right, Rishika. The vaccines are here, and it's wonderful news that the scientific community, manufacturers, government agencies, and the entire ecosystem has lived up to the promise. Like we just heard, they come in high-end refrigerators and with good power supply and some cutting-edge technology in trucks as well, which now leaves just the last-mile transport and the delivery issues, which has been largely unaddressed. We still use crude forms of non-compliant systems like ice packs or gel packs in plastic boxes, which end up dropping temperatures below 0 degrees Celsius and rendering free-sensitive vaccines unviable, or they go above 8 degrees Celsius as they melt in the upcoming summers. And this usually goes unnoticed. So in a nutshell, I wouldn't be comfortable to take a vaccine that came to me in an ice box, because the whole issue with getting both shots of the vaccine is that we are going to get complacent now and believe things are back to 2019 while I head out to parks and restaurants without caution, while in fact I'm putting myself at greater risk of catching the disease.
Yes.
Right? So, and the worst part of it is that very few people are aware of the risks of poor cold chain. It's likely that one gets a vaccine which had lost its potency on the way, and then a week later end up contracting the disease anyway, and he will blame the vaccine, claiming the vaccine itself gave me the disease.
Mayur Shetty, if I can then understand, because you highlight a very important problem, and we'll get the medical experts to address that as well in just a moment. But how do we combat that problem? You're saying that if anything in this entire chain, this entire transportation chain were to not work at any juncture, you're saying that the vaccine could end up being unviable for the person who's receiving it. What are the safeguards that have been put in place to combat that?
Yeah, I mean, so far we've not had any alternatives to portable medical grade refrigeration. It's been a thermodynamics issue, and that's kind of where we come in right now. These are some sociological problems we've learned during vaccine-derived polio as well. Absurd conspiracy theories around inefficacious vaccines being administered. And these pose some very serious problems because they erode the government of India's painfully built up confidence in people in the process of immunization.
Right.
And our work has been in delivering efficacious vaccines with a portable medical grade refrigeration system that is ergonomic, fits into a backpack. It carries 300 to 400 vials, 300 to 400 doses, about 30 to 40 vials, which means you can administer about, it's meant for day-long transport of vaccines. So you can reach some of the farthest corners without risking that your vaccines are going to waste.
Okay. Mayur Shetty, what are the safeguard mechanisms? You have those last mile connectivity backpacks that carry vaccine vials. What are your safeguard mechanisms?
Right, there's 100% accountability that we're assuring. So it's not just cold chain. While we are guaranteeing that your vaccines are going to come to you in a safe condition, the health authorities are getting continuous data. They're completely fully aware of live vital statistics like the location, the temperature, what areas are being immunized, who's being left out, who's getting vaccines. Moving ahead with support from Government of India, we're actually building up a newer traceability system as well for advanced monitoring of vaccines with vaccine-wide traceability of kind of figuring out who is getting which vaccine from which manufacturer, which batch, which lot. So end-to-end traceability in terms of online monitoring is something that we're working on right now.
All right. And Dr. Rakesh Mishra, how important are some of these measures that both Kunal Agarwal and Mayur Shetty have just talked about?
Oh, these are very crucial things. You must know which vaccine first dose person was given. So second time, the same vaccine should be given at the second dose. It can't be something else. And people are moving. So I'm sure with the electronic system of monitoring and creating the database, these are the things that will come in handy. It's very important to have. First, it was very reassuring to see that the stakeholders are so confident. That really makes us feel good. And monitoring of who is getting which vaccine is getting, so that they can go to another city after 1 month, 1.5 months, and they can get the same vaccine second dose. So those things should be enabled. and it is big exercise. It is very challenging. But remember, we are the IT power in the world, and we have been handling such a large
Right.
scale thing every few years for various elections and many other things. So I think, and now people are sensitive, people understand the importance. And people also know that the first batch is very informed people, second batch will be again frontline
Yes.
workers. So
Yes.
by the time general public starts to come 50 plus and other criteria, by then we will have lots of experience
Right.
and